Welcome everyone, and thank you for joining us today for today's webinar, Engaging Students in Biostatistics Using Statistical Computing to Promote Learning. My name is Suzanne Walker, and I'm a Senior Marketing Manager here at Jones & Bartlett Learning. For those not familiar with Jones & Bartlett Learning, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. So now let me tell you a little bit more about today's presenter. Dr. Lisa Sullivan is Associate Dean for Education at Boston University School of Public Health. She's professor and former chair of the Department of Biostatistics and is a former co-director of the graduate program in Biostatistics at BU. She also led the BU Summer Institute for Training in Biostatistics from 2004 to 2016. Additionally, Dr. Sullivan is a recipient of numerous awards for excellence in teaching at both the undergraduate and graduates level, including 2 prestigious awards at Boston University and the ASPH Pfizer Award for Teaching Excellence, which is an annual award given out to the outstanding teacher in accredited schools in public health in North America. Professor Sullivan has extensive experience as a biostatistician on the Framingham Heart Study, working on the development, evaluation, and translation of risk prediction functions. She's authored over 200 papers and several books, including Essentials of Biostatistics, 4th edition, and Biostatistics for Population Health, both published by Jones & Bartlett Learning. And now I'd like to turn the presentation over to Dr. Lisa Sullivan.
Thank you, Suzanne. Thank you so much for that very nice introduction. It is really my pleasure to be here with all of you. Thank you for joining. What I'd like to do is give you a feel for what the book is about, some of the new features in it, and just orient you to some of the techniques that I'm using to engage students and get them excited about biostatistics, which I think is something that really it's easy to do because there's so much data out there, there's so much that we can work with, and I'll just highlight a few things as we go through our time together. So what I'd like to do is start with the job outlook for biostatisticians. This is something that all students care about, as they should. And then we'll talk about data, and this has not been more evident than it has been in the last 2 years. And certainly there's an increase for students with data skills. We'll talk about that a little bit. And then focus a bit on how to engage students in active learning. Again, getting them excited about biostatistics. And then if you'll bear with me, I'll go through a little example on how to teach a particular topic just by way of example. And then talk a little bit about the JUMP software. If you haven't seen it, we'll talk in detail about how you can access it with this book. I happen to love this software. I integrated it into my biostatistics course a couple of years ago, and I can tell you the students really like it. The reason is they can pick it up very quickly, they can build their skills and build their confidence, which is really important, I think, when we teach biostatistics. So we'll talk to you about how it can be integrated and techniques you can use. So first, the demand for biostatisticians is very strong, and the job market is expected to grow by almost 34% between 2016 and 2026. The job outlook is really strong for statisticians, mathematicians, and statisticians, even more so than all other occupations. So this is an area of tremendous demand, and I always tell students if they have an interest and an aptitude in this field, there is going to be a job for them. And it's a very satisfying job that they can feel good about because they're using their skills to actually make a difference for people's health. And I probably don't have to tell any of you here today that data is essential. And again, this has been so evident in the past couple of years with the pandemic, where we've all, every citizen across the globe has been trying to understand data to assess the extent of health issues and disease. And I've been involved, as Suzanne said, in some of my work trying to understand risk factors for cardiovascular disease. That's just something I've had the privilege to work on with the Framingham study. We also need data to evaluate interventions. And again, thinking about COVID, which, sorry if it's so fresh on my mind, but we needed to look at techniques in biostatistics to evaluate interventions that had potential to disrupt the pandemic and its spread. We also need data to monitor progress towards goals. And these can be any goals. They don't have to be related to research. Any kinds of goals need monitoring so that we can understand whether we're going in the right direction. And then certainly to impact policy. So biostatisticians are essential to work with policymakers and people who lobby for policies to provide the evidence in support of certain policies. So just an example, I like to bring examples from the news, from the internet, things that students are looking at into the class. And, the key for me is to try to make it real. We don't want to talk to students about all these theoretical concepts. We want to make sure they understand how to apply the things that they're learning in class to what they're seeing every day. So this is just the epidemic curve that ran from March of 2020 all the way through August of this year. And, we were all monitoring figures such as this. And there's nothing mysterious. There aren't any, complicated calculations here. These are just counts, but so very important for all of us to be tracking what was happening with the pandemic as it evolved over the past 2 years. And this is a screenshot of the Johns Hopkins Coronavirus Resource Center. If you've seen it, there's actually quite a bit more that goes below this screenshot where anyone who opens this up can dig more deeply into any area around the globe or on certain metrics that are captured here. And this is something that I found students were liking to track, liking to see what was happening in real time. And again, we need data to actually do our work in biostatistics. And this was something that I was bringing into class and having students analyze it and consider what was happening and how it was happening in real time. And this is just the last example of sort of making it real. I always try to think of examples that are of interest to the students. The things that I'm interested in aren't always of the greatest interest to students. So certainly the mental health and other issues that have been complications or sequelae of the COVID pandemic that affect our students are issues around mental health. I mean, more than 60% of students reported an increase in anxiety. And these, again, are data that are important for students to understand, and sometimes they're reassuring for them to see some of these things because they might be feeling some of these things in class. And so this particular report, you can see the source at the bottom of the slide if you're interested, just has a lot of data around the impact of COVID on college students. So these might be the kinds of students that you're working with currently. They also, in this same report, go into other aspects of life. So students' academic, how they were coping with their academics during the time of COVID, their relationships, and what they were doing in terms of self-care. And again, I really bring this up only as an example to make things real, to have students discuss the data without getting into too much about, well, how did those data come about, but thinking about context, because I think that students get excited when they can see that what they're learning in class, whether it be descriptive statistics or inferential statistics, is applied, and how important these things are for life, for not only people who are studying, professionals, but for an educated citizenry. And on top of all of this demand for data, the demand for data skills is actually growing. So 82% of leaders in a recent survey expected their employees to have basic data literacy. And that's actually a high bar for people. 70% of employees are expected to heavily use data by 2025. That's more than double from just 2 years ago. 4 years ago. I've lost 2 years, as maybe most of us have in the pandemic. Almost 80% of leaders say departments equip employees with the needed skills, but only 40% of employees feel they've been provided with these skills. So I think this is an opportunity for us teaching biostatistics to work in some of these data skills. As students are learning the concepts and the applications, let's bring in the data skills so they can use them to apply what they're learning and take them into their careers. So now I want to move on to engaging students. I think this is really a difficult time to be teaching. We've been through a difficult couple of years, but we've got to re-engage with our students, and I take it as sort of a challenge to spark interest on the part of students. We need more people, as you just saw from the demand in the field of biostatistics and statistics. We need more people entering our field because of people retiring, moving on, and so forth. There's a lot of opportunity for students. And I think the way to get students excited is with realistic, relevant, timely, important applications. Our students want to make a difference. And so they want to learn, even in a course like biostatistics, how to make a difference. And in our case, it's with data and with data analysis skills. And again, I bring up this word confidence again because I do think it's really important that students develop the knowledge and the skills, but the confidence is another piece of it. And for those of you who teach biostatistics, I think we all agree that a lot of what we do is sometimes getting students over a mental block that they can't do it. And I hope that you will see with the addition of some of the statistical computing tools that these are a good way for students to build confidence. So the approach with this book, it's in its 4th edition, is we've tried in various ways to engage students and get them active in their learning. So each chapter starts with a section where we call it when and why, and we try to bring up a timely topic, something hopefully that is of interest to our students, and we ask them questions. Sometimes they're provocative questions, sometimes they're just open-ended questions to get them thinking about something that is coming up in the news, something that hopefully is relevant to them, and then asking them questions to go further. Do they understand what's being shown here, or what are the implications? And we've tried to put these in each chapter to get students excited about what they're then going to learn with that particular application. We've also tried to include lots of different examples in the text so that students who are interested in global health or interested in maternal and child health or interested in policy, we've tried to put lots of different examples in to attract students who might be interested in pursuing education in a particular area. We've also added in this new edition, the 4th edition, what we're calling an illustrative case study on COVID-19, where what we've tried to do is add to the end of each chapter a mini case, a small description of something that was happening around the pandemic that uses the technique that we're talking about. So, for example, in the section where we talk about 2-sample tests, we might talk about some of the clinical trials that were done to evaluate promising therapies for treating people infected with COVID. And we just try to highlight these, understanding that they might be time limited, but to show students how important the techniques are and have been when you have an issue like COVID or, God forbid, something else, the next thing. There are a lot of practice problems in the book and in the instructor resources, which we can talk about. And the pieces I want to highlight today are the statistical computing aspects. We've always had, as a companion to this book, a workbook that illustrates the calculations, the computations, and interpretation in Excel. And our thinking there was lots of people have some familiarity with Excel. Hopefully they could pick it up easily. And it might be accessible to people, students and faculty, to use Excel. But we've added to this particular book a second option for faculty, and that's with the JUMP software. This is a SaaS product, and we'll talk more about this later, but you can get access to the JUMP software for you and for your students. And we have a workbook that goes along with the textbook that has some larger, more realistic data sets for students to really get their hands dirty on some of the techniques that we describe in the book. So we'll talk more about JUMP and Excel as we go along. But I really think it's important to integrate the statistical computing. I am a strong believer that students have to know what they're calculating. I do make them do hand calculations, but then I quickly get over to either Excel or JUMP because I want them to do the analysis the way it is realistic. And again, I find that integrating the computing does get students engaged or re-engaged, if you will. We've sort of been in a funny period. It promotes collaboration in the class, and it can only take sometimes 5 or 10 minutes for students to apply something that they've just learned. And I keep saying this, I'm sorry, but it does build confidence in students, and I think that's so very important. And we have lots of data sets that we've provided with the resources here, and JUMP has many, many data sets that instructors can use for examples. So if you'll bear with me for just a few minutes, I'd just like to go through an example, a sample topic that you might present in class. And so this is the example of teaching students how to do the chi-square test of independence with an example focused on opioids. So this is an abstract from a clinical trial that was reported in the JAMA Open Network. And I don't know if you've used this before. I find this a great resource because they have a lot of visual abstracts. I'll show you one in the next slide that are really nice to concisely, quickly bring an application into the classroom. So this was a study, and they're talking about opioid overdose deaths, which were in 2021 at the highest levels in the United States than any prior year. And so this particular study was looking at an intervention, and I'll show you the details of it in just a minute, an intervention that happens in the emergency department to try to link individuals at risk for substance use disorder to treatment. So this next slide shows the visual abstract. Now, there's more on the right-hand panel. I purposely blanked it out for the moment, and I'll show you why. But this is the visual abstract. Again, these are, they're open on the web, and you can share them. So the copyright is not an issue for these because they are open. So this particular trial involved over 400 men, 200 women who had a mean age of about 37 years. They recruited participants for the study from 2 emergency departments in Rhode Island, and they randomized them to either work with a social worker in the emergency department or a certified peer recovery specialist. So this was someone trained to help work with these patients, in this case, to link them to substance use treatment. And their goal was to engage students with treatment within 30 days of their visit to the emergency department. So this is something that I might put up in the class, get students to say, you know, what do they understand? What are the issues with this particular study? And then if you go to the next slide, we can ask some questions. What exactly is the outcome that the investigators are looking at? And again, in this case, it's the participants getting engaged with substance use treatment. And how is it measured? And here it's a dichotomous variable that they're measuring. Either they do or they don't within a particular time period. There are 2 comparison groups. So here's where we can talk about 2 independent groups, you know, as opposed to 2 matched or paired groups. And what exactly are the investigators looking at, and why is it important? And then we'll get to the data. Now I'm putting back the piece that I hid for you for that last view. And so now here are the results over on the right-hand side. And so the authors are reporting that 30% of the participants assigned to a social worker were in receipt of substance use disorder treatment, as compared to 32% who were assigned to the certified peer recovery specialist. So then the question is for students, is that important? Is that significantly different? And so here are the data that we want to look at, and now get students to think about, okay, what is the setup here for doing a statistical test? We have 2 independent groups. The participants were either assigned to see a licensed social worker, or assigned to meet with a certified peer recovery specialist, one or the other. So these are two independent groups. And then our outcome was whether they engaged in substance use treatment within 30 days of their visit. And so then we go into what is the process for testing whether there's an association using a test of hypothesis. So our null hypothesis is that there's no difference in the percentages of patients who engaged in treatment, versus our research hypothesis might be that there is just a difference in treatment, or in this particular study, and we'd have to look more at the background of the paper, maybe the authors were interested in demonstrating whether a higher percentage of participants who were assigned to a peer would go into treatment. And then we summarize our sample data, which was just organized in that little table, calculate a test statistic to summarize what we're seeing in our sample, and then determine statistical significance, practical, and clinical importance. And I always add that last bullet so that students go one step further to really understand or communicate what is important about a particular study. So now let's take an example from beginning to end. So here's an example where we're asking, is there an association between hypertension status and incident cardiovascular disease, say over the next 20 years, in patients between 30 and 50 years of age? So the data on the next slide were observed in a prospective study. So this is data from the Framingham Heart Study, where we classify individuals as having hypertension, high blood pressure, at a point in time at the start of this particular study. And none of the participants have cardiovascular disease at the time of enrollment. And we follow them for 20 years to see if they develop it. And so these are our data. We have two independent groups. Participants are either free of hypertension or they have a diagnosis of hypertension at baseline, and then we follow them for the development of CVD. So this setup mirrors the one that we just looked at in that visual abstract. And so here are several versions of the way we might write our hypotheses. So first, hypertensive status and incident CVD are not related or are independent. Another way to say that is there's no association from a statistical perspective between hypertension and incident CVD. Same, the percent of patients who develop CVD does not differ by hypertensive status. And again, I think it's important to try to show students the different ways that hypotheses and other statistical statements are written so that they don't get hung up on just one exact way of saying things. And then under each of these is the research hypothesis that's suggesting that there is a relationship and association and so forth. So it's hard to see whether there might be a difference in the percentages of patients who develop CVD looking just at the raw data. So what's been added now are the percentages of each group, and by group I mean those free of hypertension, those who have hypertension. And here now we can compare directly the percentages, because it's hard to compare the 65 to the 206, which are the numbers who develop CVD, because the denominators are different. And so the question now is there a statistical difference in the percentages of patients who develop CVD according to their baseline state of hypertension? So now we're talking about 5.5% versus 8.9%. And overall, in the whole sample taken together, the overall percentage is 7.7%. So as we all know, the appropriate test would be the chi-square test of independence, because we have a, in this case, dichotomous outcome, but it works for ordinal categorical outcomes. And we have two independent samples. This procedure works for two or more independent samples or groups. And then here's our test statistic. So getting students to think about, if we were to compare the two groups, what we really want to compare is the percentages of individuals who develop CVD in each of our groups. And the chi-square statistic looks at observed and expected frequencies, which are summarized in our table. So here's another table that shows the expected frequencies. The observed frequencies are our data, those we had previously. Here we have the expected frequencies, that is the number of patients we would expect to develop CVD and to not develop CVD if the groups did not differ in terms of their likelihood to develop CVD by hypertensive status. So overall, 7.7% of participants develop CVD. What we do to calculate our expected frequencies is we apply that percentage to each of our groups. So we take 7.7% of 1182, and that gives us 91, and 7.7% of 2,318 gives us 178.5. So if there was no effect of hypertension on the development of CVD, these are the numbers of individuals we would expect to develop CVD. Now here I always say, now clearly we're not going to have half a person, 178.5. These are theoretical values, so I tell students we take this to 1 decimal place and that's sufficient. So now we can calculate our test statistic. So the test statistic for this test calculates for each cell, each of the 4 cells, which are determined by hypertension states and outcome states. We take the observed number of patients, the number that were in our sample, minus the expected, which is what we just calculated, square that difference and divide by the expected. And we do that for each of the states, each of the cells of our table, and we summarize these. So 12.63 is our test statistic. In other words, it's the summary of the data that summarizes essentially how close the sample is to what we would have expected if the null hypothesis were true. So now the question is that number, 12.63, evidence in support of the research hypothesis or not? So the next step is to summarize statistical significance, and that is through a p-value, which represents the incompatibility of the data, our sample data, with the assumed statistical model. Sometimes we say it's the probability of observing data as or more extreme under certain assumptions. So here we can have students jump over to Excel, and if they wish, and they can calculate the p-value using the chi-dist function in Excel. So they can enter the data, and you can see that in the screenshot in the bottom right-hand corner. So this chi-dist function wants the observed test statistic and then degrees of freedom, and it will produce your p-value 0.00038. So then the next slide, we have the summary of our test, our null hypothesis, the research hypothesis, our test statistic, and our p-value. And we would reject the null hypothesis in favor of the alternative because the p-value is less than the, let's say we use the standard level of significance of 5%. So we would say we have statistically significant evidence to show that the percent of patients who develop CVD differs by hypertensive status. And we did see a difference when we actually looked at the raw data. So now the next question is this important for students? And I would say it is, because we certainly want to do everything we can to reduce the risk of someone developing CVD. And if there's a way to intervene, let's not let them develop hypertension in the first place. That would certainly reduce their risk. Now, the other thing that you can do as an instructor, so you can use Excel to get the p-values, which people are used to seeing in research articles and things like that. You can also use Excel worksheets that we created that will allow you to easily do the tests. So this is a screenshot of the worksheet that we put together for the chi-square test of independence. And the way it's set up is the student enters data in the yellow, everything that's highlighted in yellow is for the student to enter. So if they enter, there are 2 rows in the table. So I'm thinking of a row in this instance as the number of hypertension states. So people were either classified as having hypertension or not. And then the number of columns are the 2 outcome states that we analyzed here. You could certainly have more rows and more columns for a chi-square test, but here we have 2 and 2. And so then once you enter 2 rows, 2 columns, the table just below that will populate and it'll say row 1, row 2, column 1, column 2. And then the students enter the raw data into the yellow highlighted area for the 4 cells. The student also specifies the level of significance in the top right corner. And once the raw data are entered, the spreadsheet will calculate the chi-square statistic, which appears at the bottom, the chi-square statistic of 12.6 with a p-value 0.000. If we let it go more decimal places, we would get the 0.00038, which is what we just showed. So this again is another way, if you'd like to use Excel to have students conducting tests, they can just pull up these worksheets that are already programmed to conduct these analyses. So now back to the example that we started with. Let's try to reproduce those findings that the authors published. So the authors published the sample sizes for us, and they gave us the percentages that were engaged in treatment, the outcome. We can use the same setup and populate the table with the observed frequencies. We have to do a little calculation to get the frequencies from what was reported, but we produce a chi-square statistic of 0.228 and a p-value of 0.63, which is exactly what was published in the paper. And I find students like to reproduce things, just gives them a feeling like, okay, that looked kind of scary when I saw it at first, but now I can do it, and it's not so complicated. So next example, this just gives you an idea of how we've incorporated JUMP. So Excel is there if you'd like to integrate that with what's happening in the class, and you'll have students jump back and forth between whatever you're doing in the class and Excel. With JUMP, we've tried to provide what we're calling data analysis problems, so bigger problems, if you will, bigger data sets, and we've included a number of resources for you to use in class. One is a data set with 500 subjects who were participants in the Framingham Heart Study. And these are data that were put together specifically for teaching. So it's real data, but it has been sanitized for use for teaching. But it's a big data set, and the students hopefully can feel like they're using the real data from the Framingham Heart Study. So the way we present data is we will give students a link to the data set, and you as instructors can grab that data set. We tried to give them a code book, if you will, so the variables that are included in the data set with some description and some coding details, because this is the kind of thing that they may potentially engage with. And a sample problem for JUMP might look like this. Here we ask students, are the risk factors outlined in this table significantly different in males versus females? And so here they would take the data set, and we'll show you in a screenshot in just a second, and actually analyze these associations and report out in the table, maybe in a homework assignment or in class exercise, the numbers in each of the different categories, and then the chi-square statistic and a p-value. So if you've not seen JUMP, the data, the way it's organized, looks like an Excel table. And what I've done here, this looks kind of messy, but the data set is sitting behind the results table, which is in the front, where in this case, I've analyzed the association between sex and current smoking. And so here the students have to go back and look at the code book. Who's a 1 and who's a 2? And what does it mean if someone's current smoking is coded 0 or 1? And then they get their chi-square statistic and their results. And after doing this analysis, they can fill in the table like what we have here. So here we'd ask students to fill out these tables, and we've provided for you all of the solutions files along with at the top We provide the code, the steps that you would use, and certainly you don't have to provide this to the students if you don't want, but in the solutions file, you can see how exactly to generate the results, and then we provide the results in the tables and then some description for the students. So you can tell I really like JUMP, and it's something that I brought into my teaching a few years ago, and I find it to be very user-friendly. It may be new to some of you, but I really suggest that you take a look at it. What I like about it is that it's point and click to a degree, but with many point and click software packages, I feel worried sometimes that students can do the incorrect analysis and have no clue that they've done something incorrectly. In JUMP, you have to correctly classify variable types or else it won't do the analysis that you want it to do. So I feel like there are some checks and balances here to guide students to the right analysis depending on variable types, numbers of groups, and so forth, which is the way that I teach, so I felt it was a good fit in that regard. Students can generate analysis and focus on interpretation, which I think is what most of us find most interesting about biostatistics. There are lots of resources for faculty, including an extensive sample data library. So if you're looking for data on a particular topic or to illustrate a certain concept, there are lots of data sets built right into it. So literally in class, you can, together with the students, open up a data set and have them work on something. And again, I've found students to really like it, pick up on it quickly, and build their skills and confidence. So I apologize for talking so long, but I'd like to turn it over to Sophie Teague. She is the product manager at Jones & Bartlett to say a little bit more about JUMP.
Great, thank you, Dr. Sullivan, and that was a great presentation. Thanks so much. For JUMP, Jones & Bartlett is very pleased to partner with JUMP for this 4th edition of Essentials of Biostatistics in Public Health. And what they've offered is a free 1-year student subscription of JUMP, and that's to all faculty and student users of the book. So all you need to do to access the free software download is to go to this URL, go.jvlearning.com/jump, complete the form. You will need to use a .edu email address. That's how they authenticate, so to speak, that you are a valid user, and then check your email for an authorization code. From there, you'll go over to jump.com/SS download and you'll complete the form there. There is an additional step from there. You'll get an authorization code and you just follow the step-by-step instructions to review and accept the user agreement. And then you can download and install from there. And Dr. Sullivan has included, as she mentioned, there's 2 workbooks included within the ebook. The JUMP workbook is over 125 pages with chapters aligned to the concepts in the book, loaded with screenshots and very user-friendly step-by-step instructions for using JUMP. And with that, if there are no questions, I'll hand it over to Suzanne to take general questions.
Well, that was just an information-filled presentation. Thank you, and thank you, Sophie, for filling everyone in on JUMP. We do have time for some questions, and I noticed there's one here that I see in the question box, which is to Lisa. What environment do you hold your courses in? A computer lab? Do you have lab time? How many hours a week?
No, I generally teach biostatistics in a regular classroom. And one of the things I should have mentioned is JUMP works very well on both a PC and a Mac. So I have students bring their computers to the class, and you know, I may do a presentation, start off with an example or whatever, and then have the students open up the computer and try an exercise. So it doesn't need to be in a lab or even in a place where the computers are all configured in the same way. It works as well on a Mac as a PC.
Okay. Can JUMP data sets be imported into SPSS?
I don't use SPSS, but I suspect so. The JUMP data sets can be exported into Excel and actually into many other formats. So I think you could export the JUMP data sets that we have and then import them into SPSS. It offers lots of different formats, so I think that would be very easy to do.
Sophie, do you see any more on your end?
I do see one that's just come through. How would you compare JUMP versus SPSS or SAS?
So JUMP is a SAS product. And so we here at the BU School of Public Health, lots of our students take SAS. We also teach R. We don't use SPSS. So the output that comes out of JUMP is exactly like what you would see in SAS. However, for beginning students, it's much easier for them to generate that output than the way they have to learn coding in SAS. So that's why I've started to use it in my class, because it gives students a feel for how to generate the output, see what it looks like before getting bogged down, if you will, in the coding. I expect it looks similar to what you've seen in SPSS. Unfortunately, I don't use that, but I think they're similar in the way the output might look. So it's much more realistic, I would say, than the output that you get out of Excel. I mean, we're making Excel do the kinds of calculations we want it to do, but this is a kind of a different level of output. I hope that answers the question.
Thank you everyone for joining us today and for all of your thoughtful questions and comments. Also, I'd like to thank Dr. Lisa Sullivan for providing some great insights on the importance of data and the demand for biostatisticians, as well as sharing her approach for teaching and engaging students in biostatistics. Thanks again for attending. With that, I'd like to conclude today's webinar.